test this out. At first, I want to say yes, I wasn't sure, this is something that would work. And then I said, okay, well, it can't hurt, I can try it. So I said, well, I'll try it on dry eyes first, because I think that's the easiest to test out, because I can put what's called a fluorescein stain, so you can see, because tears is clear. And then you put a stain on it and it makes it yellow. Or actually, when you shine cobalt blue light on it, it's greenish. So you can actually easily see the tear film. And we study what's called the tear breakup time, so T-BUT for short. And anything over, so when we blink, the tears cascade down. It covers or lubricates our whole eye and protects it from the elements. Now, after a period of time, it breaks up. So anything under 10 seconds is considered abnormal. So over 10 seconds is considered good. But most of us, being that we're on our phone, computers, and staring, the tear breakup time is really short now. So people will complain of burning dry eyes. And the reason for that is the tear is gone, but we are still staring at the computer and not aware that we need to blink again until it's like burning really badly. And then the whole process repeats itself throughout the entire day, throughout the entire week. So we're left with just dry, tired eyes at the end of the night. So that's a lot of patients tell me that. And so I initially just told them, use teardrops, but then some of them say, well, I can't put that in my eyes, or it's hard to remember, things like that. So that's why I wanted to use it. I said, well, that's my biggest complaint is dry eyes. Let's give it a try. So I had some patients tried it, told them to put it where the acupuncture points to follow what's on the video, on the website there, and come back in about a week to see me. And I had one patient, my first one, she was 14 years old. She came back, and when initially her tear breakup time was 2 seconds, between 2 and 4 seconds, very short. And then when she came back, I counted beyond 20 seconds. I stopped counting, but it was amazing. I was like, wow, that was my first, review of that, and I was like already amazed. And then another one, she was 22, I want to say. She had to go back to school. So there was she could only wear it for probably 4 or 5 nights at most, I think 4, and came back, and she had dry dead cells at the bottom of her cornea, and those were gone when she came back. So, and she said her eyes were refreshed when she woke up in the morning. Didn't feel tired. It wasn't, I think she said it was a little red in the morning too, and she said she didn't have that too, and she was pleasantly surprised. So, so when I saw these results, I was pleasantly surprised, and I said, wow, maybe this does work. Because I was a little skeptical first. So having seen that, so I started to expand that to my daughter, she's 17 and nearsighted. So I heard that it could help minimize the nearsightedness, so I wanted to give that a try. So she used it for 25 days, and then I retested her. She had a stigmatism of 1 diopter stigmatism that dropped down to half diopter, which was that was incredible in just a short time. And then her nearsighted reduced by 1/4. So I'm going to have her. We're going to repeat that test again after she used it for like 2 or 3 months. She had to stop for a period of time. She has very sensitive skin, so her skin was getting a little irritated from the patch, so she had to stop. And then once she healed, she resumed. So that was one thing I noticed. So the 2 side effects I've noticed is just the initial stinging, but then, so my daughter had stinging at first, and other customers, other patients were saying the same thing, but they said that it disappeared after a couple days, so which was good. And my daughter said it didn't bother her anymore afterwards. But then there was tearing. So I was told that the tearing is natural. The tear just basically flushes out all the, it kind of detoxifies, I guess, is the way it was explained. So that's why you have that initial tearing. And then as far as the sensitivity of the skin, I guess that's the other thing that I noticed that my daughter was having. But I'm still, you know, early in reviewing it, so I'm still excited to see what else it can do.